It's time for a health report, and joining us now is A54 Health correspondent Linord Moudou with a look at added symptoms for COVID-19.
The U.S. Centers for Disease Control and Prevention has added 6 new symptoms to its existing list of symptoms for COVID-19. The coronavirus is highly contagious and potentially deadly, but the vast majority of people who become infected will show either no symptoms or only mild ones. Chills, repeated shaking with chills, muscle pain, headache, sore throat, and a loss of taste or smell are the 6 new symptoms the CDC cautions that could be signs of COVID-19. The symptoms usually appear within 2 to 14 days after exposure to the virus, according to the CDC. It recommends seeking medical attention immediately for trouble breathing, persistent pain or pressure on chest, bluish lips or face, or a new confusion or inability to arouse. Experts say the expanded CDC list is significant as most testing sites require a patient to have a COVID-19 symptom before the individual can be tested. Because a loss of smell and taste has been identified as a symptom of the coronavirus, health experts say anosmia, or the loss of smell, is a common symptom for respiratory viruses, such as the flu. In our Ask the Expert segment, Dr. Carl Philpott, professor of rhinology and olfactology at the University of East Anglia in Norwich, England, elaborates on the loss of taste and smell associated with COVID-19.
Some people are getting it at the beginning before other symptoms. Some people are getting it after other symptoms have developed. And there is a group of patients who seem to be getting that and nothing else at all. And I think that's why it's important to kind of investigate the association further, because obviously if some people are getting only that symptom, then they're wandering around there as sort of, as carriers of the infection without perhaps realizing and perhaps isolating themselves in the way they should do if they'd had the other symptoms which they're recommended to isolate for. Well, typically we see that women for post-viral loss tend to be classically more affected on a ratio of about two women to 1 male patients. Certainly, I think the notable thing about the data so far is that it seems to be the younger patients that are getting the smell loss and younger than we typically see for post-viral smell loss. So it seems to be people in their sort of 30s and 40s that are getting this a lot. Typically, viruses, as I say, cause about 11 to 12% of all cases of smell loss in the community. But it may be that percentage goes up as a result of this pandemic.